So hello everyone. My name is Arihant. I'm with the student neurology interest group at New York Medical College, and I'm talking with Dr. Amadeo today. So just real quick, Dr. Amadeo, could you give us a quick introduction about what you do?
Sure, absolutely. Thank you for having me here today. I'm very passionate about our future of neurology, so it's wonderful. So I am, as you said, Dr. Katherine Amodeo, and I am a neurologist. I specialize, sort of fellowship trained in movement disorders. So I primarily see the neurodegenerative movement disorders, Parkinson's disease, as well as Huntington's. As part of my training in movement disorders, I had a lot of exposure as well as additional training in memory care. And so something I'm passionate about is actually the neurodegenerative diseases, Alzheimer's and Lewy body dementia, which could include Parkinson's disease with dementia and dementia with Lewy bodies. That's also a big portion of what I do and what I see. So I'm currently up in Poughkeepsie, New York. We're part of the Westchester Medical Center affiliates, and I'm at MidHudson Regional Hospital in Poughkeepsie. I could talk a little bit more about how I got here if that works, but
Yeah,
I
for sure.
actually, yeah, it's special to be back in the Hudson Valley. So I actually grew up in the Hudson Valley, in Marlboro, New York. I did go to undergraduate at Marist College in Poughkeepsie, New York. So right across the street from where our hospital up here is, which is special because they have a lot of opportunities to actually reach students at the undergraduate level while I'm here. So I teach Marist students, have them come shadow me, things like that, which I enjoy, as well as working with New York Medical College medical students, which I love. So following undergraduate, my education at Marist for undergraduate, in which I majored in biomedical sciences and minored in psychology. I then with knowing that I was going to, pursue a path in medicine, I applied for medical school. I did actually take a year out from undergrad and going to medical school, and I did research. And it was actually that year doing research was really pivotal for me. It kind of shows, how I kind of got where I am. So I took a year out and I did research at the Harvard Institute's Medicine in Boston,
Mhm.
actually in a Parkinson's disease lab. So we were doing more bench work, but it was during that time and in my research and reading about the disease and the patients of, impacted by this disease that I think it started my calling to Parkinson's. I just found, obviously the disease devastating, but the people so inspiring, and the complexities and the underlying pathology, was fascinating to me. So that actually kind of started my trajectory into Parkinson's disease, which is, what I primarily do every day is
Mhm.
there for patients and families with this disease. So from there, I applied for medical school, and I went to University of Buffalo in Buffalo, New York,
Mhm.
upstate, way upstate, and I loved it. It was a great time. I tried to be open-minded during that time, just like all of you, but
Right.
I never really lost the passion for neurology. That's what I wanted to do. I
Mhm.
love neurology, and I think actually my bio science class, the first 2 years in neurology solidified that because I loved the neuroanatomy, and I loved learning about how, something in this part of the brain can cause this. I just found it fascinating for localization and all of that. So it really, I didn't stray far from neurology, even though I tried to be open-minded. And then in my third year and fourth year, where I was doing my rotations and, getting that amazing exposure to everything, neurology was where I felt at home.
Mhm.
So that's really how I got here. It sounds like probably similar to a lot of you in this group, which is great.
Right.
Um, and so from there, I applied for residency. It's a big match, just like with all the specialties. And I matched at the University of Rochester, which is also way upstate New York, University of Rochester Neurology, and I did my residency training. It was, I loved my training and my time at Rochester. I actually stayed on for fellowship. I was a selected Edmund J. Safra, Michael J. Fox Fellow there, and I had excellent mentors. And my fellowship, like I said, I split my time. It was a 2-year fellowship, and I split my time between movement and memory care, which kind of gave me this niche in movement, but with the focus in the cognitive aspects of the movement disorders.
Mhm.
Stayed on for faculty for a year. I helped, with our establish of the Lewy body dementia research centers of excellence. I was one of the PIs. I did a lot of research actually while I was there, as well as clinical. And then the pandemic happened, which and I at that time, which I think we're going to get more into with your questions, but I think took this look at what's important, to me, in addition to my career and my love for medicine and neurology. What am I missing? And I was really missing my family. And so I actually had the opportunity to come back to the Hudson Valley, where I am now, during the peak of the pandemic, August 2020. And I'm so glad it just really worked out, because I'm doing what I love among the people I love.
Mhm.
Yeah.
I can imagine like being back where you grew up too.
Yeah, it's been really, really fun, and
Mhm.
it's been amazing to be near my family, and
Yeah. So you mentioned that your initial experience during your research year before medical school that got you interested in like Parkinson's. Um, so I'm just wondering, is there anything that drew you to the Parkinson's research in particular in the first place that
yeah.
possibly led to you going into neurology?
That's a great, great question, and I think it also shows an important, I guess, life lesson in there too, is that sometimes we have our lives planned out, but then something happens that maybe leads us in a different direction, but it was maybe where we're supposed to be, and it's okay. So I had early experience, with my grandmother with Alzheimer's disease. So I think ever since I was a little girl, I was very much aware of this, this neurodegenerative disease, Alzheimer's, and how it can have an impact on your memories. And I saw, the relationship, how it was impacting my mother as, the granddaughter, or the daughter of, well, so it was actually my great grandmother. So she was the granddaughter. And I saw that, and I just knew I wanted to be a part of that in some way. Like, even as a young girl, I was like, this is horrible. How can I help with this?
Mhm.
So I always had this, this passion for the dementias, and particularly Alzheimer's, I think because of that early history, and then, the more exposures I had. So when I was at Marist, undergrad, when I was, thinking about what I wanted to do, and thinking about medical school, I actually applied for the Barium Goldwater Scholar. And in that application, I wrote about a proposal for Alzheimer's research. And in that, in writing that and so forth, again, I learned so much more, and kind of again showed me that this is what I want to do. In reading about that, I actually, was reading a lot of works from this one lab at Harvard Institutes, and my chair, at the dean actually at that time at Marist was like, why don't you just message this PI and see if you could do research there. So I was like, okay. So I think that's a lesson too for everybody, is that, hey, doesn't hurt to ask, put yourself out there. The worst that can happen is they say no, but sometimes you land somewhere else. So at the time, which is okay, his lab was actually full. And so, but he directed me to his postdoc, who had just branched out to his own lab. And his name's Dr. Matthew Lavoie, and he's wonderful. And I'm forever grateful for the work I did with him, and just working with him. So he actually did have, an opportunity for me, and he did Parkinson's disease. And so that's how that happened. And the rest is history. Okay. So sometimes, you have to put yourself out there. You may land somewhere else, but that may be where you were supposed to be.
Right. Yeah, I'm
Yeah.
glad you touched on it, like how to get into research in the first place, especially just
Yeah.
like cold emailing can be daunting, but you never
Mhm.
know, it could work out.
Worth it. It's worth it. And so that's something I'm helping, even the Marist students now when they're thinking about their summer. I'm like, if I can, I'll help with the emailing, but otherwise I'm like, just reach out and you'll and see.
Okay.
Yeah.
Yeah. So the next question I had, so you already touched a little bit about like the conditions that you treat usually, but is there any condition that you treat more often than others or that you just see most commonly?
Yeah. The most common condition or disease state that I see is Parkinson's disease. That's by and large mostly what I do. And then within that, I would say the second most is dementia with Lewy bodies. Those are the two most common things that I treat every day.
Okay. So it sounds like also like the demographic that you treat, it's mostly the older side.
Right, it is right. So unfortunately, Parkinson's is very common, and we're all at, unfortunately, we're all at risk as we get older. It is a disease of aging, just like, most of the neurodegenerative diseases. And so, yeah, so most of my patient population is 65 years and older, and that is my favorite population. I love working with older adults. I love the perspective they have on life, and I learn from them, and learn, how you can live your best life with these diseases as well as an older adult. So I love working with older adults. Yeah.
Yeah, it sounds like you came full circle to like
Yeah.
your great grandmother having Alzheimer's, and then now you're treating the older population as well.
Mhm.
So how would you describe your current work-life balance? I think everyone knows that being a doctor, it can be a huge time commitment. It can really drain you. But have you found like ways to help yourself with that?
Yeah, yeah, absolutely. So I think medical school does a good job of preparing you and giving you some balance early on, because it's a lot of work. And so I think you get a big taste for that, and especially when you compare yourselves to maybe those that are your age who are doing a different path in life. So I think it helps teach you early that you have to learn to balance in order to find, you know, to be fulfilled, because yes, our careers are so important. That's why we're here. Otherwise we wouldn't be doing this long road and all of that if we didn't love this and want to do this. But that's not everything. I always say, don't confuse your career with your life. So career is so important, and certainly that's why you should really love what you do. And even thinking about the specialty that you love, as well as the patient population, who are you, who do you enjoy working with, and things like that. But so that's important, because that will ultimately lead to a big part of your happiness, because you do spend most of your time at work. But
Mhm.
it is important to have a balance. And like I said, it sometimes is taking time and reevaluating that, and saying, am I living the truth that so when I think about what's most important to me, where are those in my day-to-day life? And I actually did that. I did that during the pandemic, where I was like, what's most important to me? And my family is certainly very much at the top, and I just felt like I wasn't seeing them as often as I'd like. So I think being back home, and being able to see my family whenever I like
Mhm.
is a huge part of my everyday happiness. We actually, this might sound funny to some people listening, but some people might understand this, depending, I guess, your background. But we actually all live on the same street, which is so
Oh,
funny. But so when I came back home, my sister had built a house near my parents, and so then I built a house next to them. And so it's been really nice to be able to have, like, we go in, we walk it, well, we can walk to each other's homes and things like that. So I think that helped with the balance, just physically being by each other. But I try to make it, particularly, as you get along in your career, I try to make it so that when I'm at work, I'm at work, and when I'm at home, I'm at home as
mhm.
best I can. Now, obviously, because of our professions, and it does, sometimes we're taking call at home or something like that. Or, I have some patients who maybe they're going through a major crisis, and they may be calling me, but depending on your patient population. Um, and that's okay. Again, that's why I'm here. That's why I'm doing this. But as much as you can, I think it's about being present when you with your personal time when you can be, and really making the most of that. When you have a free weekend, you plan it. I do. I have the best weekend I can that weekend. I book it. I look ahead at my schedule. If I'm not on call, then I have plans.
Mhm.
So I think that's important.
That's really nice to hear that you
Yeah.
have it working out. Uh,
Yeah.
so if you had to estimate around like how many hours a week do you think you'd work, and also how often would you say that you're on call?
Yeah. We're actually in a bit of a transitional time now, so I don't think this is very reflective of how it will be. But typically, I work, anywhere from eight to 10 hours a day, Monday through Friday, for sure. And then about once a week, I'm on overnight home call. So I might get called on just emergency things, let's say a
Mhm.
stroke coming or something like that. And then we pretty much are taking weekend calls. So again, we're we're home, but we're getting phone calls, and then we may come into the hospital and see patients. That's pretty much once a month.
Mhm.
It varies wherever you are and wherever you go. In Rochester was a little, I was doing more research there, and there were a lot more of us in terms of neurologists. So I was pretty much just doing that like 2 weeks out of the year. This weekend and call schedule here, it's a little bit more. Um,
Mhm.
but it's just a different pace here too. So it works.
Okay. Um, and looking back to residency, how would you say your schedule back in residency compares to that now?
So, residency, well, there are, guidelines in place to make sure that we are not, for safety reasons for both us as well as the patients. So and I think everybody really sticks true to that, particularly my residency very much protected us as well as the patients with the restrictions on work hours. So you're not going to go over 80 hours or anything like that. And we certainly didn't. We had really good, backup and coverage. But yeah, I mean, you're working like 12, 14, yeah. You're pretty much working 6 days a week. That's for sure. So it's 6 days
Mhm.
a week. You get one day off from what I remember from residency. And they were longer days, but again, we never broke work hours, never. And when I look back, while it was hard, it was hard, long work. It was one of the, I actually just saw my co-residents at the AAN. I don't know if you guys had the opportunity to go, but it was just this past weekend. We were just saying how we were like family. We just love it. It was such a great time. We worked hard, but we had great times
Mhm.
with both learning as well as personal time. So you have free time. We would go out to dinner together, things like that. We were there to support each other. You do have time off. You have at least I can't remember, but I want to say you have like at least 2 weeks, at least 2 week vacations, as well as you have some elective time. And those are times where you can certainly have more personal time and things like that. But I wouldn't trade it. We were actually talking about this because we were like, gosh, we worked hard. Would we go back? And while we maybe wouldn't want to go totally back, we would go back for a little bit just to be together and have that time to just learn. It's the you just learn so much, and you have that support, which is amazing. So
Mhm.
yes, it's hard work, but it's invaluable.
Right. Yeah, I'm
Yeah.
sure, like, I haven't experienced it myself, but I feel
Yeah,
like it might be comparable to like when you're in undergrad or when you're in med school, when you have like friends and peers supporting you.
exactly. They become like your family in another way, and you put that time in, and as you've seen with undergrad and med school, time flies. So you do it while you can when you're in it, and then it won't be forever. And then
Mhm.
most of your life is being an attending, where you have more autonomy and flexibility. So it's worth
Right.
it. That's why you want to learn as much as you can before you're off on your own. Yeah.
Right. So how would you say your time is split between if you're doing research and like academic like teaching? So what would you say the time split is for that?
Yeah, again, it's going to be variable depending on where you go and what you're looking for. So if you're if you're thinking more of an academic career where you're at an academic center, like here at Westchester Medical or where I was at University of Rochester, you likely will be doing some aspect of academic work, which is mostly research, but can be teaching,
Mhm.
can pursue more of a teaching path. So when I was at Rochester, I was pretty much, I want to say I was like 60-40. So I was like 60% clinical and 40% research and other academic pursuits.
Mhm.
My days were in, up there were like, I think I had a total of like 3 to 4 half days of clinic a week, and then the rest were doing clinical trials. And I was doing, like I said, a lot of clinical trials at the time, either as sub-investigator or co-investigator or PI, principal investigator.
Mhm.
And so that was how I mostly divided my time up there. And I was probably doing less teaching than what I'm doing here in Westchester Medical or MidHudson Regional. So up there, pretty much the teaching I did was limited to when students would actually rotate with us on electives, or if residents would rotate with me in clinic. It was more of that like bedside teaching.
Mhm.
Where here, which I'm happy because this is kind of what I want, what I am really wanting to do. I'm in clinic more, I would say. So I'm in clinic every day. Wednesdays and Fridays, I'm a half day for more protected academic time. And in that time, I do more teaching.
Mhm.
And so I do help with the bioethics course down at New York Medical College for the second years, which I really enjoy. I help with that. We have students rotate up here, and I come down and do the pathology course. I'm giving a Parkinson's lecture actually to the students next week. And then I also teach, it's separate from my work here. I do it in the evenings, but I teach an ethics course actually at Marist College for the cappings class. And then I still have kept, a working collaborative relationship with Rochester. So, I may be finishing up papers and things like that I worked on there. I
Mhm.
did have one clinical trial here so far, and I'm hoping to get more. It's just right, like I said, we're in a transition zone. So hopefully once we get more support and so forth, I'll be getting more clinical trials. But we did one clinical trial during my time here so far. And that I pretty much spent like a day each week with seeing patients in the trial as well as working on trial
Mhm.
aspects. So that was great. Yeah.
Nice. Yeah.
Yeah.
That sounds really interesting, like doing clinical research as well.
Yeah.
Um, so you touched on this earlier that you like make sure that you have time to spend with your family and just for yourself as well. Do you have any tips for like if anyone's just daunted by this, just tips that would help them achieve the balance that they're hoping for?
And I'm so glad that you're asking that important question, because I think sometimes we are afraid, for whatever reason, to like talk about that, but it's so important. And you're not going to be happy unless you have that balance. And so I would say just, like I said, setting boundaries, evaluating what's important to you, and what makes you tick, and you have to carve out the time, and you have to protect yourself, and so but I like I said, and then it's thinking about maybe what your career will look like. I think if you do go into a more, I would say, more academic, while there are pressures with, perhaps research and teaching, I think it's a little bit more flexible. So you might think about that as opposed to, let's say, private practice, where, it's a little bit more of, I hate this term, but like eat what you kill. So like you have to see a lot more patients, and you might be more, I guess, you're just more busy with the clinical aspects just in order to keep your practice running, and maybe more business. So I think it's thinking about, again, how you see yourself, what makes you happy, and you can make it work for you. Now I just, I've talked to some of my, like I said, I met up with some of my co-residents who are in different aspects, different parts of their lives maybe. And so, one of my colleagues, he just told me that he's going like 80%, so because he wanted to spend more time with his kids as they're growing up. And
Mhm.
he's able to, I guess, financially do that, which is wonderful. So I think, and that doesn't mean that that's forever, but right now in his life, he's like, I want to be with my kids more. And so he's cut back on his clinical obligations for now.
Mhm.
It can be transient, it can be always be matching with where you are in your life. I think there's a lot of beautiful aspects of what we do, because we're doing, something it's a tremendous privilege. It's really pushing you as far as you can be pushed. You're always challenged. But I think also there is this flexibility too, where you can make your career what you want it to be
Mhm.
for the most part. Yeah.
Right. Yeah, and it's just important to know that in the short term you might be like putting in more work, but then in the long term, if you're getting burnt out doing it, then it's not going to amount to much.
You can pivot. Yeah, exactly. Exactly. If you're not happy, then you got to make a change.
Right.
But I think for the most part, just taking those times and reflecting, you'll know what makes, even just making that choice of you guys, being in this neurology interest group, you've made this, you're thinking about neurology. It's similar. You're thinking about where you would be most happiest, what patients make you, tick, things like that.
Hmm. Okay. So that's a nice segue actually.
Yeah.
Um,
Okay.
so
Yeah.
would you do you have any tips for people who are aspiring to neurology?
Yeah. Well, firstly, good job. You've made the right decision. Okay, and that I really do think this is an exciting time for neurology. So obviously, I think neurology is the coolest field in that, you're working with the brain. You're working with, just amazing things, and it's just always fascinating. I think it's endlessly fascinating, and so that is awesome. You've already made that challenge. But I think, we're entering we're in the brain era, as they say. And I think this is an exciting time, as evidenced by all the neuroimmunology therapies coming forward for Alzheimer's. We've just had a breakthrough biomarker for Parkinson's, where we can now make a diagnosis earlier, which will help with clinical trials and ultimately disease prevention and so forth, by looking at a biomarker in the spinal fluid that just was hot off the press 2 weeks ago. So we're in a very exciting time for neurologists. So again, I think you guys have made an excellent choice. And what I would say is, as you're going through your training and, building, getting to the career you want to be in, just, keep your curiosity, keep that inquisitiveness, because that's obviously what drew you to neurology. No, I think sometimes they talk about how we can make a diagnosis, but we don't have many treatments. That's not true. Okay. So know that there's so much you can do for your patients with neurological diseases, even if it's not a cure. The way that we can help with symptoms is amazing. And sometimes it even is just being there as a person to support the families going through these diseases. So I think don't lose hope, never lose sight. Drawing on your heartstrings, I think, is very important as as an aspiring neurologist,
Mhm.
to know that you can really offer a lot. They say with our diseases, that first encounter, that first diagnosis encounter really can set the course for a patient and how they, respond to the diagnosis and go forward with their hope or lack thereof. So never lose your compassion, never lose your curiosity. And as you're thinking about, where to go in neurology, whether it is general neurology, which by the way is very important and we definitely need. So if there's anybody who wants to do general neurology, don't think you have to do a specialty, because you don't. You'll be very busy as a general neurologist. But if you're thinking about specialty, similarly to how you chose neurology, think about, again, where you're happiest. And that the way to do that is to rotate through the different subspecialties, work with different attendings and so forth, and see all that you can see. And that's where residency and is so important. And I think also think about, are you more of an inpatient person, a hospitalist person, or are you more of an outpatient clinical practice? That's a distinction that you can make as you're going through your decision processes. Am I an acute person? So some people, they're like, I stroke, that was me. I love to localize. I like the acuity. I like to be there, and fix something right away, which is exciting. Or are you somebody who doesn't like that acute setting, like myself? I prefer to, not be in a stressful state and be there more for, I love the continuity of my outpatient clinic and being there for our patients and, in the long run. So I think listening to that and, yeah, I guess that's what I would say there.
Okay, so the last question we have to you, it's how do you predict that the field of neurology might change over the next 10, 20 years?
Yeah, I think that this is what's really exciting, and I'm particularly excited for you guys in the future, and that I think it will be very different in the positive way. I think we're going to have more preventative treatments for these neurodegenerative diseases like Alzheimer's, like Parkinson's. We're learning more about the pathology of the disease and then how to go after it. And so, with Parkinson's, alpha-synuclein, we think is the protein behind the disease, and that it misfolds and aggregates in the neurons. And in Alzheimer's, it's the amyloid beta and tau plaques. And, as you're seeing, we're having treatments, infusions that go after these tangles and plaques. And so I think it will be different, and that we're going to have a lot more to offer and hopefully change the disease course, or, ultimate goal to cure these diseases, which is or prevent them. I think preventative medicine is also going to take a huge jump forward in that we're identifying risk factors. We're identifying, exposures, environmental exposures, and things like that that may put people at risk for these diseases. And I think, preventative medicine is going to be so important in preventing these from even occurring based on what we're learning. So I think there's going to be a lot more treatment options and hopefully cures in the next 20 years.
Yeah, that sounds really exciting. Just being able to
Yeah,
cure these diseases, which we couldn't have even imagined curing like 10 years ago.
exactly.
Yeah.
Yeah,
Okay,
it's an
well,
exciting time for sure. Mhm.
yeah. So that's all the questions that I had for you. Actually, I guess there's one last one. Just a fun question. What would
A
you say
theme, yeah.
what would you say is your favorite part of the brain or the nervous system in general?
Yeah. I think this is such a fun question, and it is one that I think we talk about amongst ourselves, neurologists. And so we often say, like, are you a peripheral neurologist or a central neurologist? And I'm definitely a central neurologist. I love the brain and the brain stem and the spinal cord, because I think I love the localization of, when something, um, particularly core. I think if I had to say, this is maybe not even specific enough, but I would say cortex is my favorite because
Mhm.
of, for example, with epilepsy, which, if somebody, comes to you with a rising foreboding feeling, it can localize to the temporal lobe. And I just find that like amazing at how somebody's symptoms can tell you where the lesion is, and the symptoms that can occur because of the brain, I think is amazing. So I would say definitely more of a central neurologist. I like the brain and the brain stem the most. Basal ganglia is another, I would say, top up there because of obviously Parkinson's.
Mhm.
So
Nice.
yeah, thing.
I have
That's
to
a
say
fun
that
question. Yeah.
yeah, I have to say the basal ganglia as a medical student, it's like so hard to
So
learn.
complicated. Yeah, I think if you rotate up here with me, I'll kind of walk through it in a very simplistic, um, approachable way. That's how I think about it. Because yes, it can be very daunting, but we can break it down. Yeah.
All right. Well, this has been really insightful and I'm sure very helpful for anyone, undergrad or medical student, thinking about neurology as a career. So again, thank you so much for meeting with us, Dr. Amadeo.
Of course. Thank you so much. And yeah, if anybody has any questions, you know how to reach me. All right.
Yeah.
Okay.
All
Thank
right.
you.
Thank you.
Bye-bye.
Bye.